neck pain on the left side here. It kind of starts down by his shoulder blade and extends up to his neck. So let's just go through some range of motion. We'll check out the neck there. So maybe bring your chin down to your chest. Does that cause any pain going forward like that?
Yes.
Where does that painful? Right through here?
Right there.
Okay, and then look up towards the ceiling. Any pain going up like that?
Not as bad.
Okay, and then rotate your head a little bit this way. Any more pain?
A little bit, yes.
And then go away.
More so that way.
More so that way?
Yep.
Okay, look straight ahead. Now turn your head to the right side. Pain going that way?
A little.
Okay. And then go to the left side for me.
More that way.
More going that way?
Yep.
But still on this side?
Yep, same spot.
Okay.
Yep.
So he's definitely limited range of motion. It's all kind of pulling right through this upper trap levator scapulae muscle here, and he's definitely has some knots and trigger points here. So what we're going to do is we're going to do some dry needling to this area, and then we're going to do some Graston technique to help loosen that up as well. And then at the end we'll adjust it to help restore some of the range of motion. Okay, so the first part we're going to needle is right here. He's got a big trigger point right there. So we're going to palpate it. And the patient feels just a dull, achy sensation when we hit that trigger point. Sometimes there'll be a little twitch of the muscle like that. And that's it. So we're going to leave that needle in. We're going to do a few other spots. I'm going to come from a different angle. There's another spot. And sometimes you'll see some redness around where we needled, where there's a problem area. Now this muscle extends all the way up to his neck there, so that's why a lot of times patients will present with neck pain, even though the problem area could be a little bit lower. But we basically just want to treat that whole area. Now the needles will only be left in a few minutes, and then we'll take them out, and then we'll continue with some more soft tissue treatment. Okay, good. So all the needles are in. Now what I'm going to do is I'm going to apply some electric muscle stimulation to the needles, and this is just going to create a little muscle contraction. It doesn't hurt, it just feels weird because the muscles will be contracting without you moving. So we're going to see what that looks like here. There it goes. And let's do... It's contracting underneath my hand. That's obviously a big contraction. We're going to turn that down. What they found, this helps to relax the muscle and decrease pain. Okay, that's it. So it's a quick treatment, but very effective at providing muscular pain relief and helping to break up the knots. Okay, so at this point we just did the dry needling. Now we're going to do some Graston technique on this area, and this is just going to massage out any further tightness he has in this trapezius levator scapula muscle area through here. So we apply a little emollient to the skin that allows the instrument to slide over the affected area. And what it essentially does, it's going to help to modulate some of the pain and tightness and help to loosen this up. A lot of times when you get over an area where there's a problem, kind of like a hurts good kind of feeling as you're kind of working it and loosening it up, you'll see the area will turn a little bit of red in this area, and that's good. That's going to increasing the blood flow to that area, which is also going to help with his range of motion. Just like the dry needling, it's a pretty quick treatment, but really effective, again, just like the needling is, especially for this area where we see a lot of chronic tension, either if you've slept wrong or if you work on a computer most of the day, like most of the people see. Okay, we're going to do just one more technique, This next technique, it's gonna manual technique where I'm gonna use my hands to help loosen it up. So with this, we're gonna add in some active motion, and this is called active release techniques. So what we're gonna do is we're gonna start here. We're going to bring your head down and away. Like that, perfect. And bring it back. And underneath my thumb, we're loosening up the tightness and helping restore some of the motion and the mobility in the muscle there. And I can feel an area when it's tight, it's pulling right through this area here. And this actually extends all the way down into his shoulder blade region. Good, now looking straight ahead, let's rotate a little bit to this side. Good. Great. Alright, so right now we're just checking the patient's joints out in his neck where those muscles attach. And so he has some restriction, some tightness up here. So we're going to help to restore some of his mobility by adjusting his neck. So as first position, I'm going to have you rotate my way a little bit. Just like so. Good. Nice and easy. There we go. Okay, now we're going to treat this other side here. Same thing, nice and easy. There it goes, good. Just going to recheck to make sure we got, yeah, it's moving really much better. Okay, and now go face down on the table one more time. This time, drop your arms all the way to the outside of the armrest. Just let them hang. There you go. And take a nice deep breath in. All the way out. Good. Okay, great. Come on up for me there. And now let's recheck your range of motion. So have a seat. I expect it to still feel a little sore because of how tight the muscles were, but I want to just check to see the range of motion to see if it's improved.
Gotcha.
So let's have you go chin down to chest. Good. And then look up towards the ceiling. Great. Look straight ahead. Slowly turn to the right. Good. And then go to the left. Good. Come back to neutral. How does that feel in comparison?
Moved much easier.
Yeah, it definitely looked a lot better. So it's just going to still be a little sore tonight. Drink a little bit more water. That will help with any soreness. You'll be all set, okay?
All right.